Hi, I'm Dr. Tim Shea, board-certified foot and ankle surgeon practicing in Northern California. I'd like to speak to you about the idea of incorporating minimally invasive foot and ankle surgery into your practice. Although I've been in practice for a number of years now, I found recently that I was having problems with getting reimbursed for foot procedures performed either in the hospital or at a surgery center. I noticed that the percents were being removed by the companies that were paying, and there was reimbursement numbers were decreasing, even though the responsibility for surgery was increasing. In addition, I'd also become familiarized with the idea of minimal invasive foot and ankle surgery, which now is beginning a resurgence in the United States. Both these factors led me to listening to some webinars which were provided by Dr. TJ On back in about 2017, 2018. As a result of these very fine webinars, I was able to get in touch with Dr. On and participate in his Chicago International Cadaver Seminars, as well as the cadaver seminars put on by the Academy of Foot and Ankle Surgeons. Between these, I became convinced that this was the new era of a new technique that we can offer our patients with opportunities to provide these services both in the office and surgery center with potential for less pain, less discomfort, and increased quality of life. As a result of working with Dr. On, I was able to develop the basic techniques of these procedures. Although I was familiar with the techniques provided by traditional surgery and still do use them occasionally, the idea of being able to take the concept of doing foot surgery and provide it in a smaller environment with less trauma, less tissue dissection, and less potential for complications intrigued me. In addition, I found Dr. On's enthusiasm and ability to mentor and coach myself and others extremely important in order to be able to implement this type of therapy into my practice. Subsequent to this, I did join the MEFIS Accelerator program, which I found very, very exciting. It was worthwhile in a number of different ways in that it allowed me to get started on the properties of minimally invasive surgery and then to be able to provide the equipment and the concept of building an office-based surgical practice. At this point, I've been participating for about 2.5 years. I find that I'm quite busy doing minimally invasive surgeries, approximately 3 to 5 cases a week, whether being done in the office or at a surgery center. I'm finding that my patients really appreciate the opportunity to have these procedures performed and take care of their problems. I find it's very, very important that I stay in touch with Dr. On as a coach and mentor, as his enthusiasm and knowledge is without like that I know of in our profession at this time. Dr. On provides for me and others in our group insights into performance techniques and well as even complications if we have them. I would say now that my practice life is significantly different than it was 2 years ago. Not only has it financially been more rewarding, but it's also more exciting for me to come to work and do procedures and be able to offer something more for my patients. I've always been interested in my whole practice and being able to provide good service to my patients, and this service has definitely added that one more step of quality that I feel was important to them. I would recommend to anyone who is thinking about participating in this program that they do so as soon as they can. The fact is, minimally invasive surgery is beginning to resurgence in the United States, and more patients are coming in daily from hearing about it in different sectors and asking me about it. Fortunately, I'm able to offer it to them, and they seem to really appreciate that. If I was not able to do so, I think it would be very frustrating both for them and for myself. I also find that participating in the MEFIS group is rewarding in a return on investment concept, which is that the amount of your investment should increase your return. And this is what I've seen, as much as 10 to 20% increase on a yearly basis without increasing overhead in any other way. So again, if someone's thinking about this and wants to think about what can they get from it, I recommend that take it from an older practitioner who's been through a number of years of different types of practice, that this is the type of thing you want to do. Good luck to everybody. And definitely, I find Dr. On's involvement to be helpful and as a mentor and as a coach.